Pick up platform, both DJ has been speaking to it this morning, was on Super FM. So we have a bigger platform within media institution here.
So folks, this is our exclusive interview with the Director General of the National Public Institute. Director General will speak on the monkeypox, this sickness that is in country. So the Director General, Dr. Dougheh Chris and the Deputy General. So there's a short interview, so keep following Terra Television, it's your life.
So we come to talk monkeypox.
This interview is surrounded against monkeypox, new sickness started in Liberia. So keep following.
So he will speak to you briefly, then we'll entertain questions. Thank you very much.
Yeah, thank you very much, ladies and gentlemen of the press. We welcome you. We know there have been heightened anxiety with respect to the impending outbreak reported by the World Health Organization and the Africa CDC, as well as the Africa region, WHO. It was reported, and we got to learn that there's an outbreak of Monkeypox virus, the disease simply called Mpox, caused by the Monkeypox virus. This virus is within the family of the smallpox viruses, but it is different from chickenpox, and so we want to make that clarification. It comes with various symptoms that include fever, headache, muscle ache, lymph node swelling. One of the notable features is the formation of rashes on either the extremities and the entire body. But the extremities are exposed, the hands and the feet are where you basically see them, because someone may be clothed and you may not see what's on their body. So, yes, this disease, what in medicine we call self-limited disease, meaning that it can heal by itself, but the question remains the different defense mechanisms that our body can provide us to fight against the disease. If you have a limited amount of defenses in you, you could be overcome by the disease, although it's self-limited. So that means our immunity, what in science we call our immunity. So we may have different levels of immunity. Now, those that we are concerned about, mainly with respect to this impending outbreak, or this outbreak now that is becoming global, children under 15 and under, and those with a low level of immunity, what we call immunocompromised. The fact that they are immunocompromised suggests that they may not have enough what we call antibody or those defenses that are in our body to fight back. So those are the demographic and the population that we are very much concerned about. It's not that we are eliminating every other person, but that's our concern mainly. There are medications available which are being used to treat other viruses, and those medications can be used also to treat Mpox when one is infected. When you become infected by this disease, it takes anywhere between 2 to 14 to start showing symptoms, what we call the incubation period. And so what happens, I know the question will remain, how do you contact? It's through person-to-person contact, through maternal child or maternal fetal transfer, and these are the two major ones that we want to inform you about because of our social setting. We are people who shake hands, we are people who hug each other, we are people, so we're looking at these two major forms of contact. Of course, mothers always have their children with them. Then, of course, in the process of pregnancy and all of that, the contact that exists between mother and the fetus. And then this person-to-person contact among us is something that we want to also emphasize as one means of transfer or transmission. And another thing we can say is that your question probably later on in detail will be, are we in the state of combating this particular disease? Have we had it in Liberia before? Yes, we've had cases, but from the work that we have done as an institution over the years, since I think 2017 or so, we've to this date have detected 5 cases. The last case being in May 2024. So since that time, we have not detected any other case, but we had to stick that during our recent release that was sent out so that you know that we are aware of this. We've had it. The good thing is that we've not had any death from that, which is really good, no fatality. So Liberia has not reported any fatality because those who were suspected, and we want to make that clear, these were suspected cases, and they were not necessarily confirmed cases. We didn't have any death coming out of that, or any debilitating sickness, meaning somebody got sick with it and then we're incapacitated at the end of the day. These people recovered and they're living what we may describe as normal life, not from as a result of the infection. And so as an institution, we've been mounting and building that capacity to respond to diseases since the time of Ebola up to this present time. And so we have the capability to conduct diagnostics in order to see what we've been confronted with. We are building the capacity to distinguish those monkeypox or whatever other strain or variant that may be coming up, to distinguish whether it is the new one or it is the old one. And that can be done in collaboration with our other partners that have the more highly technical aspect at their end. So based on utilizing regional collaboration, we are able to robustly now see if we have a certain strain circulating in Liberia or not. Since the announcement was made by the WHO, the NFIL has been working along with the Ministry of Health in order to activate our response system. We will not go through giving you acronyms here so as not to confuse you, but we'll simply point that into saying that our emergency response system, pandemic response system, is being activated. Not only at the national level, but also at the counties and community levels. In recent times, just in the last 48 to 72 hours, the team has gotten to work to get in contact with the county teams, and we're going down to the community, and that will be coordinated from there. We're also looking at getting in contact with our point of entries, which means our ports, RIA being our major port of entry, and then the various ports of entries along our borders around the country, taking into consideration Ivory Coast, particularly where a recent case was detected and reported by the WHO. In the region, Nigeria, and around the continent, we have Central Africa, really heavily hit with Burundi, Rwanda, I believe Uganda, DRC, Congo taking the heaviest of hit. And so in the coming days, again, when we get together, because of our travel in these countries, we have a lot of Liberian students, a lot of Liberians going to Rwanda these days and in the east of the continent. Myself going there most times in the past, we may be issuing travel advisory, which is very important to keep our people on guard, so that when you go to these countries, respect the laws that are there, follow the public health regulations there, just as you follow what we have here. I will just throw in, because of the nature of diseases that we have been coming across to epidemics in the recent times, in the last, say, 15 years, that COVID is on the rise again in the United States. And you know our heavy traffic between the U.S. and Liberia. So in various states, particularly California and in the Midwest and somewhere out east, the cases have been increasing during this winter period as compared to past winter. You will know that the U.S. president himself got infected some time ago and had to be quarantined. And so we will be looking at that as an institute to prepare safeguarding materials for those who will be traveling to the U.S. or coming from the U.S. so that they obey the laws when they get there, and those that are coming, they obey the laws when they get here. And so our port of entries will be very basic. On the Mpox situation, we are particularly looking at the borders with the Ivory Coast and Guinea, and other borders that are cycling us. And our major port of entry, which is the Rabat International Airport. And so, in this summary, but a little detailed form, that's how much information we can offer now. When you ask your questions, we will direct your questions to the appropriate persons that can give you any further detail that you need.
Thank you very much. So, distinguished police, when you get questions, you have to call your name, institution, and pose your question.
Yeah, thank you so much, Mr. Weah, for the recognition. My name is Anthony, and I work for ECOWAS Radio. I'm a bit concerned about our local people that are in rural parts of Liberia. The message of this virus that has come to be the Monkeypox virus. How are you intending to reach out to them in their local vernaculars for them to get a clear understanding of precaution measures they can take for them to stay alive and develop their little ones? Thank you.
Okay. Fortunately, before this press briefing, we had an opportunity of sitting with Truth FM this morning, and similar questions came about. With our response process and procedure being activated, as we say, we'll get down to the county levels, we'll get down to the community levels. In that respect, within the scope of the risk communication, we will do everything we can so that in terms of prevention mechanism precautions will be communicated in the vernaculars. We're trying the best we can to have that done. We know we have people who can do the translation, and all of that will make it as simple as possible. And that is why when we get on radio, as you saw this morning, we try not to use as many technical terms as possible, because the layman will not understand it. Truth FM, OK FM, and all of you reach wider populations. So we try to be as simple as possible. We'll not talk about clay 1, clay 2, and all of that. All we can tell you is there are many different types circulating, so be careful. We are trying to test which one is in your community. As simple as that. And there will be people, who can then translate that in the vernacular, in Basso, Grebo, Crew, Crown, Mende, Va, etc., Gio, Dan, Manon, in various vernaculars. So we've started to look at that aspect, and that is part and parcel of the procedures that will be put in place for effective communication. Now, the good thing is that our people have been used to seeing, pox viruses, being infected with pox viruses, smallpox, chickenpox. So at least for us, it makes it easier for us to tell them that it looks similar to chickenpox, it looks similar to smallpox. And so when you see those things that look similar to that, tell us, and we will send people to get you, or we can direct you to the nearest point of contact that you can go to. So in that sense, certainly it will give us the opportunity to do a lot of contact tracing and all the response mechanisms, procedures that we have to go through.
Okay, quickly, just to let you know that as part of this press briefing is Dr. Julius Monet from the Warrior Organization Liberia office.
Okay,
yes.
Thank you very much.
Yes.
I'm Samuka Dougheh. I'm the manager editor for Mac TV Live. It's an online TV. Back Director General, what can you tell Liberians? Because most recent time, we are going through these different diseases outbreak in Liberia. You have Ebola, COVID-19, and we have other monkeypox, and all this. What can you tell Liberians that in terms of fear, they should be, at least should be reduced? And what do you tell them in terms of these kind of viruses breaking out in the country? What encouragement do you tell them in terms of managing the pandemic or whatever? Because
yes, and all of that is contained in the risk communication and management. One of the things we've been able to do immediately is to be proactive, to at least tell them so that they're not misinformation circulating about what is this and what is that, like we have with the aircraft situation recently. Thank God we were able to immediately, when we heard that from the WHO and the Africa CDC, we immediately jumped and issued out a circular that they are allowed to tell them that we've been informed, we know of something that is coming, this is what it is, these are the symptoms you should watch out for. We are putting together these mechanisms in order to address it, just as we did with COVID, just as we did with Ebola in the not too distant past. So I think our ability to be very much proactive and engage the population with when it comes to outbreak.
thank you.
Thank you. Yes, sir. Copy Africa.
Yeah, my name is Evan Gino, I work for Campus Africa. Tad, I would like to know, I would like for you to please explain the difference between the monkeypox and the chickenpox to our local people, because they look similar. So I would like for you to please explain the difference in the medication.
Okay, from a pathologic point of view, meaning that from the way the disease takes place, all right, the contact and everything, they are the same. You contract them the same way. Then you see symptoms. For the most part, the symptoms we see that will be a distinguishing feature will be expressed on the body, because you come with fever as well. You come with a lot of other symptoms. Now, what we look at, just from the clinical standpoint, you look at the papules and the nodules that come up on the body. With monkeypox, it's been noted that they are much bigger than chickenpox that you have, they are much smaller. And the second thing is, which is a characteristic distinguishing feature, is that monkeypox comes with swollen lymph nodes. So note that sometimes when you get a cut on your hand here, then you start feeling some pain under your arm whereby you don't have a cut there. It's those nodes where you have those military people we have in our body, the antibodies that start now to come and fight against what is coming. So they build up themselves, and that's when you feel all this reaction to monkeypox is similar to that, which is not very characteristic of chickenpox and smallpox. So that is one important distinguishing feature. Then, of course, when you leave the clinical side, then we go to the diagnostic side, where now, thank God, we have these deep down molecular and serological in the palm, and they are much larger.
We are
from the mission.
Thank you. Thank you.
We are country.
Thank you so much, Dad. My name is Senior. I work for the Daily Observer. I listened to you talk about recent report about the monkeypox virus from January to something around June, May and June. And I want to know these virus, their status currently. And besides the cases currently, besides that, there are other cases today as we speak?
No, not that we know of. The only thing we know of when I was on air this morning was that people started calling and said, there was a lady who called from Caldwell and said, my children and I have been scratching and we have these things on us, we don't know, we've been taking medicine is not getting cured. So we immediately said, because